Hi guys, I'm Dr. Renee. I'm an NHS doctor, a writer, a broadcaster. This is part 2 of my menopause series, Symptoms. So when people hear the words menopause symptoms, they all think of that woman fanning herself in a room where the windows are open and everybody else is freezing to death. Now, whilst those scenarios do exist, as I can attest, they're just the tip of a very, very big iceberg. And we need a wider understanding of the multiple, complex, often debilitating symptoms that arise when the body loses estrogen. Now, this is happening because the ovaries reach the end of their natural lifespan and they no longer produce estrogen. This is a hormone. There are receptors for estrogen hormone all over the body, and they can be found in the reproductive organs, the endometrium, the lining of the uterus, ovarian stromal cells, breast tissue, breast epithelial cells, bone cells, which is very important for bone health. In the brain, certain regions are involved in mood regulation and cognitive function. And in our cardiovascular system, blood vessels are lined with them in our liver and in our mucous membranes, our eyes, our nasal passages and our mouth. This is by no means exhaustive, but it does demonstrate how important estrogen is in a female body. When you have receptors and they lose the very thing that stimulates them, it is inevitable that there will be side effects. And this is where the multiple symptoms can come from. So what are they? Well, before I answer that, it is important to say that as with everything medicine-wise, there is no rule as to who will get symptoms, how many, how bad, or for how long. So again, every woman's menopause journey will be different and unique. And for this reason, it's important for your doctor, when being asked to help you, to look at every woman individually and create an individual treatment plan. Similarly, it's important for all doctors to accept that female hormones play a role in much disease etiology, and it may not be the typical that they're looking at. It may be hormones and need a different approach. So all women at any age might have a disease process that is hormone mediated. It's also important to remember that symptoms may start up to 10 years before your periods actually stop. This means that many women are in the perimenopause period during their 40s, all of their 40s, and regular periods do not mean that they are not perimenopausal. So with this in mind, the first symptoms that women may see from their drop in estrogen are their periods, for sure. Periods might start to change, get heavier, last longer or be shorter. They may start to be irregular, either longer or shorter periods between each, and this can go on for several years or just a few months. Mental health. Now, I find, and I have experienced myself, that mental health symptoms are often the first subtle change that women see, and it often goes undiagnosed or untreated, or you're treated as someone with mental health issues, which doesn't work. It just loads women with unnecessary treatment and associated side effects without addressing the underlying issue, not enough estrogen. That anxiety can be crushing. As someone who never suffered with anxiety, I suddenly, without explanation, found myself with a gnawing pit of anxiety in my stomach all day that was so bad that I was clenching my teeth and my face ached from the tension. It was inexplicable and debilitating. Generally, women can find a complete shift in their emotional state. They may feel emotionally numb, or the opposite, over-emotional and reactive. There is also a common theme where women who've been brilliant at life and work suddenly start complaining about increased stress levels. And I tend to find that it often isn't the job or the kids have become more stressful, rather that the falling hormones are taking away those female superpowers that allowed you to cope brilliantly before. And so this then often leads women, amazing women who are usually amazingly capable, to questioning their own abilities, and this leads to low self-esteem and confidence, which is a self-fulfilling prophecy. Women often tell me that they just cry all of the time for minuscule reasons, if any, and this is often accompanied by or associated with mood swings, irritability or anger. Lots of my women tell me that they are just too angry with people around them. And recognising the problem doesn't mean you can stop it, just as with PMS. Hormones are powerful. Very commonly, all of this culminates in low mood and depression. And it's important for doctors here to recognise the previous history, and just because a woman has often had depression, it doesn't mean that this period of life is not playing a role and making it worse. It's just poop being a woman of 50, isn't it? Anyway, cognition. Alongside these mental health issues are the cognitive symptoms of menopause. Now, by this, I mean those that affect how our brain works, how we cope with tasks and skills and short-term memory. Brain fog, or a difficulty concentrating, is probably the most common symptom I hear, and I've seen a High Court judge be 3 hours late for her appointment because she went to the wrong hospital, and when she arrived said, "I just can't think anymore." Now that's pretty debilitating when you're a woman working into your 70s. Memory problems are common and definitely accelerate for many women at menopause, but we mustn't forget that life is full on, and by the time we get into our 40s, we often have a lot going on with work and kids and a home to run, and some memory issues might be expected in a busy brain. Low mental energy or lack of motivation is another symptom, and may be to do with the double whammy of low estrogen and low testosterone. Mucous membranes. As I mentioned, there are estrogen receptors scattered throughout our mucous membranes, and losing the stimulation at these at menopause can cause symptoms as the membranes become dry as a result. And this can be experienced in dry mouth, which I have now, and eyes, a burning mouth or tongue, painful or infected gums, sensitive teeth, changes to sense of taste and smell, and digestive and gut health symptoms. And let's not forget the vagina. The vagina too is lined with special mucosal cells which are by nature moist and need to secrete mucus to keep the vagina operational. When we lose estrogen, the vagina is often the first victim of this loss of secretion. This can result in pain or discomfort during sex, often making sex impossible, and sex is important for mental health and healthy relationships. Low testosterone adds to the effect, and reduced sex drive is common. And who can think about sex when vaginal dryness, pain or itching is driving us crazy and often leading to repeated vaginal infections? Add to this urinary and bladder infections, which become more common for women at perimenopause as the tissues are dry and disrupted and allow bacteria to colonise. This in itself is dangerous for women, especially as they get older, and urine infections can lead to sepsis. Temperature regulation. Although the true cause is unclear, it is thought that losing estrogen in the brain results in instability in the temperature regulation centre of the brain, and this results in night sweats. You know, where you're suddenly so hot in bed, for some dripping in sweat, but not all, and you throw off the duvet to cool down, but 5 minutes later you're freezing and hunting around for the duvet repeatedly. This leads to poor sleep and insomnia. This can often be accompanied by restless legs, so you've got insomnia and restless legs as well. But the hot sweats are not always limited to night time. Many women get them sporadically throughout the day, and it can be embarrassing as you look around you at the room and wonder why your younger colleagues are not throwing open the windows and throwing off their jumpers. And it's distracting, and for many women they feel scared or embarrassed about being in a working environment for this reason. Now, if that little lot wasn't enough, there are many physical symptoms which have for too long been accepted by many as a normal part of ageing, but can actually so affect life that it changes beyond recognition, and menopause makes them worse. As hormones change and swing from normal to abnormal, women can suffer from breast tenderness or swelling, dizziness, vertigo, tinnitus, tiredness and fatigue, headaches and migraine, dry, brittle or weak nails, thinning or brittle hair, and this is very common, heart palpitations, joint aches and pain, muscle aches, pain and soreness. Now these would probably all fall under that umbrella of just getting old, but I guess I would say maybe. But if it's estrogen loss that's making it worse, we can probably do something about it. And often overlooked symptoms of these demon hormone changes are found in the skin. Dry or itchy skin, often described as insects crawling under my skin or tingling, is one of the common symptoms, and women often don't make the connection. Doctors don't make it either. It even has a medical name. It's called formication. And I can't really come to the "and finally" bit until I talk about weight gain and body shape changes. Women start to handle fat differently and lay it down in a different way. We start to lay down fat around our tummy, and our muscle to fat ratio changes, and with that we can gain weight. But we don't have to. We do have to change our approach to food, maybe. We have to cut down on calories, and I will talk about that more in the next series of this. So finally, the gut. Now when I say gut, I mean the mucosa-lined tube that runs from your mouth to your bum. The removal of estrogen can affect any single part of this and result in a myriad of issues that include acid reflux and heartburn, bloating. But if you're over 40 and you've got bloating, please don't assume it's menopause. Get it checked out. Diarrhea, constipation, gas, too much of it. Well, that's a lot, isn't it? There are at least 40 symptoms there. So if you had tinnitus and thought you were going mad, or insects crawling under your skin, you are not. You are going through what 51% of the population will go through at some time. So don't let this vlog depress you. Just because that all sounds horrific, and I know it does, there are 2 takeaway messages. Number 1, you may get none or only a few of these symptoms, and you may cope just fine as you are. Number 2, if you do have symptoms and you do need help, it is there in many different forms. So my next vlogs will help you deal with this part of the complex journey that is menopause. See you soon, guys.